The Enabling Inclusion app, known as the EI app, is a comprehensive digital solution designed for use by organizations that are implementing or plan to implement early intervention and child rehabilitation programs for children with developmental disabilities. The EI app can be used with any rehab approach, including home, community, and center-based programs. The EI app was designed in 2014 by Amar Seva Sangam and has since undergone several major upgrades with inputs from leading experts in early intervention, child rehabilitation, and technology, and feedback of rehab workers and parents of children with disabilities. Over $400,000 has been invested in the app alone. The EI app has been successfully deployed in various parts of India, used by hundreds of rehab workers, and benefited thousands of children and their caregivers. The EI app is being adopted by numerous organizations globally. After the introduction of the EI app into our program, visit attendance rates improved from 60% to 95%, and age-adjusted school enrollment went from 70% to 85%. Child development, family empowerment, and parent-child interaction improved, and caregiver strain decreased. Use of the EI app has resulted in a 75% cost reduction by allowing us to connect community workers to rehab specialists and deploy them more efficiently. Our findings are published in international journals, covered by the media, and the app has been recognized globally through numerous awards. The EI app is designed for use by your organization's workers, which could be community workers, rehab specialists, team leads, program managers, or researchers. The EI app is in English and uses simple language with many drop-down options, making it easy to use for your workers. The EI app allows you to screen children for developmental disabilities in schools, health centers, or their own homes with simple-to-use screening tools, including the Washington Group UNICEF Child Functioning Module and the Trivandrum Developmental Screening Chart. Intervention schedules can be created for each child and worker by your team leads based on the availability of families, the intervention needs of children, and program resources. This allows your workers to have their daily schedule of activities easily viewable in their EI app calendar and can include child therapy, training, awareness, or screening activities. Your rehab workers will use the EI app to check in and check out using GPS coordinates for each planned travel and rehab activity, so that travel and work timings are logged and delivery of services is monitored on a real-time basis. The EI app has easy-to-locate information for each child with the family at the center of all intervention planning. Your rehab workers can input and view all parent-chosen intervention goals for their child using an internationally validated tool, and all initial assessments including the general assessment, which follows the WHO's ICF model, covering body function and structures, activities, participation, environmental, and personal factors. Rehab workers input individualized intervention plans using drop-down options for each child. Therapy planning is broken down into all intervention domains, such as special education, physiotherapy, vision, speech, and environmental, all depending on the needs of that child. Rehab workers can see the developmental progress of each child through graphical representations in various domains of development and various caregiver-related outcomes. These are all tracked through internationally validated assessment tools for gross motor, mobility, cognition, self-care, communication, social, academic, and recreational function for children and family empowerment, caregiver strain, and child interaction for parents. Dashboards are provided for each rehab worker, which gives them an overview of all the children and families under their care and a summary of their daily, monthly, and half-yearly targets and status of achieving those targets. The management dashboard gives a bird's-eye view of the entire program, including all children in the program, with breakdown by location, age, gender, and disability. It also includes an overview of all children screened, those on the waitlist, school enrollment, and provides an overview of rehab staff's targets and achievements. The EI app has both a web and mobile app platform with offline data entry options and automatically syncs when users come online. The EI app uses an Android system, and our data and network architecture uses the AWS cloud-based platform, meeting international standards on data security. The EI app can be configured to fit to your project's operational flow and human resources availability. We invite you to partner with us. We will license the EI app and provide extensive training and ongoing technical and rehab support. We are a nonprofit organization, and licensing fees are based on cost recovery.
This Enabling Inclusion app is a high-fidelity, high-quality, cost-effective model. We are establishing a separate social enterprise to scale this application to reach millions of children across the world through licensing model. As a person with muscular dystrophy and a wheelchair user from young age, I know what it means to be a person with a disability and how much difference it makes to go to a school and get educated. I believe that disability is not a constraint, it is only a condition, and it is my dream that no child is denied of schooling experience because of lack of rehabilitation or education. Thanking you.